Good evening, everyone. Welcome to what is a very timely webinar, a moment to take stock together as we near the close of the fall term and move ahead with final stages of planning for the spring. When I say take stock together, we might wish to note that more than 1,000 Columbia staff, faculty, students are on this call, on this webinar just now. I think we're all here because these are uncertain and unsettled times. At Columbia, we've enjoyed what might be called a privileged situation. Collectively, with the help of everyone in the community following our prescriptions for safety, we've navigated quite successfully to date, reopening key aspects of campus safely. But the challenge remains how, over time, to manage the question of campus density and how to do that as safely as possible. Now, it's worth noting that today there's quite a range of activities across the Columbia campus. Our clinical education is proceeding face-to-face, and some schools, our undergraduate Cs and Columbia College populations, as well as many courses in general studies, have been proceeding almost all virtually. And across all our schools, there's been this variation. The campus has been characterized by dramatic shifts to facilities. You can see the tents. You can even observe transformations in restrooms. And I think we can say with collective pride that no university elsewhere has done significantly better. But that's not to absolve us of confronting the challenges that are here and that remain. If anything, we are erring, if that's the right word, on the side of conservatism, sober caution. We would have liked to have reopened the gym this term. We have not. We would have liked to have reopened 5 libraries that are still closed. We have not. We would have liked to have had a more robust set of activities in all our facilities on campus. We've been careful, and we will continue to be careful. And our safe results signify that there are rewards for all of us being careful. You will have seen perhaps President Bollinger's letter today announcing that we are inviting members of the senior class back into residence in the spring in engineering and Columbia College. Most of our Ivy Plus peers have done a good deal more, ranging from half to all their student bodies. Again, we're erring on the side of conservatism. And density permitting, we may invite, depending on how many seniors decide to return, we may invite some additional students in the 3rd year back to campus. That remains to be seen. And we continue to have students on campus who've been navigating their own personal hardships. That is, they have circumstances where they simply cannot be away from Columbia and thrive educationally. As we face our continuing challenges of classroom scale limits, challenges of dining and others, we are actively planning public health issues we'll hear much more about in a moment for the spring. We have a vaccine, a planning group that's already begun to work. We are ramping up testing for the spring. And throughout, we will put public health first. But to put public health first, I just want to underscore what Donna and I underscored in a recent note to the campus, is a collective responsibility. No group of deans or senior administrators or people positioned here or there can secure a safe campus. We all have to do that together, individually and collectively. And you may have noticed, some of you will have seen that surveys that we've conducted of students, both undergraduate and graduate, yearn deeply to get back to campus, to have more hybrid classes, to connect more fully with each other and with faculty and staff. We all share those goals, and we want to get there in a measured and secure way. And of course, we all have hopes for the fall, hoping that by September, we will be back to a campus that is as close to normal as possible. In a moment, I want to turn this webinar over to Donna Lynne, who will moderate the session. She is, as you know, Senior Vice President and Chief Operating Officer at CUIMC, and she serves as University COVID Director, overseeing policy implementation. We'll then hear from Wafaa El-Sadr, University Professor of Epidemiology and Medicine and Director of ICAP at the Mailman School of Public Health. Melanie Bernitz, Associate Vice President and Medical Director for Columbia Health and Associate Professor of Medicine in the Center for Family and Community Medicine. From David Greenberg, Executive Vice President for University Facilities and Operations. Jerry Rosberg, Senior Executive Vice President, and Joseph Greenwell, Vice President, Student Affairs in the Office of University Life. I know we're all keenly looking forward to these presentations and to the chance to have Q&A that will follow. And now I turn this over to Donna. Thank you all very much.
Thank you, Ira. Well, hello, everyone. I want to just set some of the parameters around today's conversation. We're going to keep our remarks to under an hour and then leave time for questions and answer. In the same time, there is a Q&A chat function that you can use on the screen. And we also had received a number of questions from you prior to this session. Today's session will also be posted on the website a day or two from now so that others can watch it. So I'm going to do a very high level and brief overview because everybody who follows me is going to go a little bit deeper in terms of the topics that I want to cover. So first, just to give you a perspective on what this fall has looked like, we have had pretty strong enrollment in all of our programs, undergraduate and graduate. The majority of classes, as you know, have for undergraduates have been exclusively virtual, but for graduates, we've had a number of hybrid sessions and a small number of remotes. And as you heard from the Provost, there is an appetite that we've heard both from undergraduates and graduates to have more connections in the winter term, particularly hybrid classes, and certainly more connections with faculty. We have housed over 900 undergraduates in our housing, as well as obviously a lot of graduate housing. And the capacity that we're looking for the winter will more than double that. But we have to obviously watch health conditions in the city. And then we've created some isolation capacity as well. And throughout the week, we have up to 17,000, although not the same people on the same days, Columbia affiliates, that's faculty, staff, and students. So we are operating quite well in the midst of this panic. You'll hear from David Greenberg a little bit more about the facility modifications that we've made. An important part of what we're doing too is monitoring behavior, because we want to make sure that the compact, which you've all signed and are aware of, is actually being adhered to, and that we're taking disciplinary actions when that doesn't happen. And we've also created a monitoring plan that allows us to watch what's going on in New York City and New York State and on the campus, and triggers changes in how we are handling, whether it's remote classes, in-person classes, and gatherings. You'll hear a lot more about our testing program. We have developed that ourselves and have tested over 55,000 faculty, staff, and students since we implemented it in June. In a minute, I'll show you how that is going. We added a voluntary program in addition to the Gateway program and the sampling program that we have done extensive contact tracing, monitored wastewater, and now as we're getting into flu shots, offered free flu shots throughout the campus. So this gives you a sense of our testing percentages. As I said, we've administered 55,000 tests. When you think about New York City right now is at about 2.5% positive. People testing positive. We have consistently, since we started our testing program, been well below, not only that, but well below 1%. So it's something that we can be really proud of, but that we have to continue to watch. At the medical center, we also watch what's going on in the hospitals. And this just gives you a sense since July, the percentage of patients that are in the hospital that are COVID positive. And as you heard from the provost, we are most concerned about what's been happening since November 1st. Again, well below what you're hearing about nationally, but still a little bit concerning in terms of the increase that we've had over the last few weeks. For the rest of what I want to cover, I'm going to cover two things, the rest of sort of what we've been doing for the fall and then what lies ahead of us. Our technology, as you know, has not only supported thousands of you working at home, students taking remote classes, but we've also used it to ensure compliance with many of the safety protocols that we've put in place. So if you come to campus, you know that your Reopen CU app requires you to not only attest to certain health conditions, but also to attest to the fact that you've signed a compact, you've taken your training, and now that you've met your testing requirements. So this week, we will be linking whether or not you have taken your gateway test with your badge and access to the university buildings. We've seen great compliance and are continuing to work on that, but it will be a change in terms of your access to buildings. And then of course, our international students are critical to what we do at Columbia. And we have done a tremendous amount working with a number of people across the university to provide in our global centers workspaces and also in WeWork spaces. We've supported faculty and staff on a number of benefit areas. And one thing that you may not be aware of is we have an ambassador, I'll call it an ambassador corps. They're called by different names, but these are individuals who voluntarily help enforce all of the safety protocols that we're talking about. And then the last thing I just want to point out before I turn it over to Wafaa is, so where are we right this minute? You did see President Bollinger's letter, and the provost mentioned it as well, that we are watching literally daily all of the trends that are out there and talking to our peer institutions and making assessments. We will not be opening additional facilities this term because of some of the risks associated with those. Thanksgiving is ahead of us and we have numerous risks. You'll hear a little bit about some of the protocols that we're putting in place for departure and return to campus. And Governor Cuomo just 2 weeks ago changed the protocols around travel because most states now would have travel issues and a requirement for quarantining for 14 days. That's no longer the case, assuming you adhere to certain guidelines. We're well aware that cold weather is upon us, and you'll hear from David about that. And we've been working extensively on how we can flex our testing program as conditions change. And last, the vaccine is certainly in everybody's mind. We've heard about it as recently as today in terms of some new news. Our group is meeting, and I think Wafaa will be able to go into a little bit more detail on that. So with that, what I'd like to do is turn it over to Wafaa to talk about some of the public health issues that we're facing.
Can you see my screen, I hope? Okay, great. Thank you very much, Donna, and thank you, Ira. What I'm going to do today is go very briefly, give you an update on the public health situation. I'll focus on three areas. Number one will be the epidemiology, what's happening globally and locally in terms of COVID-19. Then I'll touch base on some new findings, very interesting new findings in terms of ways in which we can prevent transmission of this virus. Then lastly, I'll talk a bit about the vaccines and exciting new developments in vaccine for COVID-19. So first, let me start by giving you a little bit of the global, national, and local updates. As you're well aware, many of you are aware of this, is that the epidemic continues to grow with now more than 54 million confirmed cases globally. And importantly, the majority of the cases that are being reported globally are being reported from North and South America, from the Americas. And the top 5 reporting countries are led by the United States, unfortunately, followed by India, Brazil, Russia, and France. And the US has been leading in terms of reporting the largest numbers of cases by a single country for many, many, many months. So what's happening in the US? We have confirmed now in the US more than 11 million confirmed cases. And while the US population is about 4% of the global population, we are reporting 20% of global cases of COVID-19. There have been almost now reaching 250,000 reported cases from COVID-19 in this country, which is of course extremely alarming. If we look at the epidemic in the United States, I always say that we are still in the very first big wave. We've had several peaks, one peak that occurred in April at about 20,000 cases per day. Then we had another peak in July where we're seeing about 50,000 cases per day. And now we are moving towards record numbers of cases that have reached 180,000 cases per day as the record number. And if you look here on this map on the right, these are the average daily numbers of cases per 100,000 population. So this is adjusted per size of the population. And you can see the widespread transmission of COVID-19 in this country, but particularly the severe effect in the Midwest, particularly the upper Midwest. Now let's look at New York City and recent trends. New York City overall, we've had more than 269,000 confirmed cases and about 24,000 reported deaths overall. And as you recall, this is the epidemic curve in New York City. And we had that very rapid rise that occurred in March and April when we were reporting about between 5,000 and 6,000 new cases per day. And then we had a slow decrease in numbers of cases. And then we had several months when the city had very low numbers of daily reported cases, between 300 or so daily reported cases. And then we started observing here in early October, the beginning of this rise in the numbers of cases. And if you look here on the right-hand side, this is the daily cases in New York City since August. And here the y-axis is different. This is only up to 900 cases. You can see that what we're seeing is a slow increase in the numbers of cases in New York City over the past several weeks, which is of course of concern. What about SARS-CoV-2 testing in New York City? New York City overall, again, during August and September, had very low testing positivity with about less than 1% positivity. And now there's been an ongoing increase in the positivity rate to about 2.5% of those individuals who are testing are positive, as Donna mentioned in her presentation. What's interesting is that positivity rates in New York City have varied substantially by neighborhood and community. And there are communities of great concern where testing positivity has been high, including in parts of Brooklyn, parts of Queens, parts of the Bronx, and now the beginnings of some parts of Upper Manhattan, and particular concern about Staten Island and Far Rockaway. Now, at the same time, we know that after you get an increase in cases, you also can anticipate to have an increase in positivity in hospitalization. And you can see here again, this is similar time frame from April until now. And you can see we had the rapid increase in hospitalizations and then a slower decrease in hospitalizations. And then we're at low rates. And now we're beginning to see an increase in hospitalizations with about 600 or so individuals with COVID-19 hospitalized in the city. There is concern, of course, in terms of the capacity of the city, in terms of hospital beds as well as ICU beds, and this is another metric that we keep an eye on very carefully. So based on these data in terms of the numbers of cases, slow increase, but nonetheless an increase in numbers of cases, as well as the positivity rate increasing and hospitalizations, I think this motivates all of us to recommit ourselves to what we have been calling the non-pharmaceutical vaccine, which are all those practices that we know work. There's evidence that they work. The practices that include the limitation on mobility, as well as restriction on travel, the physical distancing, the face covering, the hand sanitizing. All of these are very, very critical interventions that we know can work. And this is the time to motivate each and every one of us to commit to adhering to these non-pharmaceutical package of interventions. So let me move to some new findings with regards to SARS-CoV-2 transmission and control. So there are interesting data that tell us where transmission is happening. These are mobility data of Americans from 10 metropolitan areas, including New York City. And what they looked at is the mobility of individuals and where they went, these points of interest, where they spent time. And based on these data, they identified and they looked at New York City, Philadelphia, San Francisco, Washington, D.C. And interestingly, they found that certain venues, for example, full service restaurants, you hear this again and again, indoor dining is not good. Full service restaurant gyms disproportionately contributed to infection. And again and again, this is what we're finding, and that lower income census block groups saw a smaller reduction in mobility because they had to essentially move for being essential workers, but also they tended to visit more crowded areas and thus were at higher risk. So what we're learning here is not every place is the same, and we need to minimize our visits to some of these high risk venues like restaurants and gyms and so on. Now, you know, and we have data that have shown that masks can prevent transmission, meaning that if I have SARS-CoV-2 infection and I wear a mask, I can prevent transmission to others. And this is the one study, there are many others, of 2 hairstylists, both with COVID-19, who spent at least 15 minutes with 139 clients. Both the hairdressers as well as the customers were wearing face covering, and none of the clients became infected. So this is very strong evidence that face coverings and masking can prevent transmission from the person who's wearing the face mask. But very exciting new data are showing us that in addition, face coverings and masks can also prevent acquisition, that is getting infected. Several studies have shown that have stimulated the release of infectious particles that show that the face coverings can protect the receiver who is in front of these aerosols and droplets. Also, a study of more than 120 households with SARS-CoV-2 found that mask wearing by the index patient and their family contacts before the index patient became symptomatic reduced transmission to their contacts by 79%. So wearing masks can be protective. And then a study in Thailand, also a large study of about 1,000 people, they were interviewed as part of contact tracing efforts, then found that those who reported wearing a mask during these high-risk exposures had a 70% reduced risk of acquiring infection. So we have evidence now that mask wearing, if used appropriately, face covering and mask wearing, is protective to the wearer as well as to the receiver himself or herself. And also we know that mask mandates work, and this is very important. This is another study done in Kansas where different counties put in place masking requirements and other counties did not. And what the study showed that the 20 counties that did so had a decrease, here you can see it here in blue, as half the numbers of infections than the other counties that did not institute masking. And actually they also showed that cell phone tracking data showed no difference and how often these individuals left home, meaning that the difference is likely due to masking. So we have again and again data that show the importance of face covering and masking, as well as distancing for prevention of transmission. So let's move on to an exciting topic, which is COVID-19 vaccines. As you're well aware, there's enormous efforts are ongoing to rapidly develop vaccines, and you can see here there are many vaccines that are moving along trajectory of research development, and there are 11 that are in large scales phase 3 efficacy studies. These are studies that are done to determine ultimately if the vaccine works or does not work, and is it safe or not safe. You probably heard about a week ago of the Pfizer vaccine. This is, again, it's called an mRNA vaccine. Remember this word because this is a new type of vaccine, has never been created before, and has never been shown to be successful as a vaccine. In the study that recruited almost 44,000 participants for this vaccine, with 42% of them globally from around the world and 30% of the US participants from racial or ethnic diverse backgrounds. And this study showed in preliminary findings that the vaccine was more than 90% effective in preventing symptomatic COVID-19. Importantly, this is the only vaccine study that's recruiting adolescents. The recruitment goes down to the age of 12. What's important also is that the findings showed that no serious safety issues were noted with this in this vaccine study. So this is very encouraging. These were preliminary studies, and the company plans to apply for an emergency use authorization from the FDA anytime this month here in November. Now, just today, this morning, we heard of another vaccine, the Moderna vaccine. And this vaccine is also an mRNA vaccine. So these two vaccines are both using the same methodology for developing vaccines. And this study enrolled a total of 30,000 participants, and about 25,000 of them received 2 doses. Approximately 30% were from racial diverse backgrounds. And you can see here they also aim to enroll older individuals who are known to be at higher risk, as well as also individuals with chronic diseases. And what they found, again, in the preliminary findings by Data Safety Monitoring Board that met yesterday on Sunday, that the vaccine was more than 94%, again, effective in preventing disease, meaning preventing symptomatic COVID-19. And also what was noted as well is that in addition, it also prevented severe COVID-19, which is very important. There were also no significant safety concerns identified by the DSMB, and the company also intends to as well pursue an EUA with the FDA in the coming weeks. So this is the timeline, as you can see here, for the Pfizer as well as for the Moderna vaccines. They both have these very exciting preliminary findings of efficacy and safety, and these companies are planning to apply to the FDA for an emergency use authorization. But there's several other vaccines that are also in the works. One of them, the Johnson & Johnson vaccine, is just 1 dose. These vaccines that I just talked about are 2 doses. The first dose at baseline and the second dose is a few weeks thereafter. But again, you can see that there's a robust pathway to development of vaccines. Now, the concern is that even if we have a vaccine, one concern that's been raised is what about vaccine acceptability? And we know that in the US, there's been concern about vaccine hesitancy and people who are mistrustful of vaccines or don't believe in vaccines. And this is one survey that asked the question, if a vaccine against the coronavirus became available, do you plan to get vaccinated? And you can see that overall, about only half of individuals affirmed that they would get this vaccine. You can see the distinction between by age, with older individuals more likely to get the vaccine, and also, again, worrisome trends in terms of racial ethnic minorities, particularly Blacks and Latinos, less likely to be willing to take the vaccine than white population. And again, as you well know, the politicization of vaccines and the politicization of all of COVID-19. We also know that in the US, we've not done well in terms of vaccinating adults. And we know that analysis has shown that we need 3 out of 4 Americans would need to receive a vaccine, prevents at least 80% of infections so that we can control COVID-19. So we have to achieve very high uptake of the vaccine if we're going to see the benefits of these vaccines. And unfortunately, over the past decade, the US, if you look here in this figure, US has never managed to vaccinate more than 50% of adults for seasonal flu in any single year, which is alarming. This includes even during the H1N1 influenza pandemic, where fewer than 25% of Americans were vaccinated. So it's really critical, very important that not only to get a vaccine, but also to inform people about the importance of the vaccine, to share with them the results and assuage their anxiety so they can accept vaccination. There is a plan, national plan, one of them developed by National Academy of Sciences that proposes a phased approach in making vaccine available based on priority populations. And similarly, also at Columbia, as you'll hear later, we also developed a similar phased approach to enabling our population to be recipients to receive a vaccine once we have a vaccine or vaccines once those are available. There's also is a global effort to provide global access to vaccine. And hopefully this will mean that not only the population in this country, but also populations around the world will have access to safe and effective vaccines, because we know that epidemics know no borders. And in order to protect ourselves, we really need to protect the whole global community. It's very important to recognize that vaccines will not be an immediate magic bullet. We know that there will be the need for many months to come to continue to observe the measures that I mentioned before, the non-pharmaceutical vaccine, because it will take many months to achieve the level of immunization both in the US and around the world. So I think now having this exciting news should motivate us more to actually make sure that we are adhering to the face covering, masking, distancing, and so on and so forth. This should be actually a great motivator for people to observe some of these measures more than ever. So in conclusion, COVID-19 continues to grow and evolve with more than 52 million cases confirmed globally. US continues to lead, unfortunately, numbers of new cases. The New York City is experiencing a surge in daily numbers of cases and a rise in PCR positivity. And then, of course, adherence to the measures that I just mentioned to you is critically important to control the spread of this virus. And vaccine development is moving fast with encouraging early findings. And there are many challenges that remain to garner the full benefits of a vaccine. And now more than ever in New York City and this country and around the world, we need to adhere to the public health preventive measures that have been shown to work. Thank you very much. And I'll stop here and hand it over to Melanie Bernitz.
Thank you, Wafaa. And good evening, everyone. Wafaa, I will just share my screen. Okay, hopefully you can see all of that. I wanted to just start by thanking you all for what you've done and continue to do to keep our community safe. The public health guidance, the compact, the testing and tracing protocols that I will describe have really resulted in our ability, as Ira mentioned, to continue with our campus activities, even though that's different. And that is illustrated by some of the statistics to date. So just a reminder of the important elements of the program: completing the daily attestation before coming to campus, participating in the required testing, and cooperating with contact tracing. These are the elements together that are helping keep our community safe. In our testing centers on both campuses alone, we've conducted over 55,000 SARS-CoV-2 PCR tests to date, and our overall positivity rate is far below New York City with a rate of 0.12% overall. We also have a very successful contact tracing program that I will describe in detail, with 100% of our cases reached within the first 24 hours and over 98% of contacts reached within 72 hours. These are really successful statistics. For many of us, completing the daily attestation before coming onto campus has become quite routine. And as such, if you've been selecting none of the above regularly, you may not have noticed the updates to the questions, which actually allow you to answer questions very honestly, but with a system that's a lot more intuitive than it was before. So if you have just been routinely clicking the none of the above, I do ask you to check the drop downs that will now appear. If you don't hit submit, you can look at the options without getting a red pass. So to review very briefly, for the questions on the COVID symptoms, if you select that that question, you'll be allowed to answer yes for symptoms. But then if you've actually been cleared by a medical provider, you'll get a green pass. If you haven't been cleared, you will get a red pass. The travel question has now been separated out, and this allows those who've met quarantine and testing requirements, which I'll talk about later, or who have an essential healthcare worker exemption or exception to answer the drop-down and get a green pass as well. Those who haven't completed quarantine and testing requirements will get a red pass. There's a new question on close contact with someone with COVID-19, and if that's selected, the drop-down differentiates those who've been required to quarantine through contact tracing processes, getting a red pass, and those who haven't met the threshold for quarantine and getting a green pass. And finally, the question for those who've tested positive for COVID-19 in the past 14 days allows the evaluation of the criteria to end isolation to be checked and then get a green pass versus the red pass that will come if isolation should be continued. So do check those out. Also be sure to scroll down below the submit button. There are 3 checkboxes for required elements to be on campus: signing the compact, completion of training, and gateway testing. If one of these is not completed, if it doesn't have the checkbox, you'll need to do so to prevent getting a red pass and, as Donna mentioned, getting inactivation of your ID access. So that's a quick way to check if you're in compliance. So I wanted to briefly describe the testing program. As you previously heard, we spent a lot of time in the summer analyzing and modeling multiple approaches for the testing strategies for our return to campus, all grounded in public health principles using epidemiological analysis and really looking at the current prevailing public health conditions. The approach we used in the fall, as Donna mentioned, has been evaluated continuously, and we have adjusted this as the situation evolved. So gateway testing, this is required for all members of the Columbia community, and this means getting an initial SARS-CoV test before accessing campus. There were many faculty and staff who did not get one early on, and if we didn't have record of their ongoing access to campus, they have now been asked to do this gateway test. We thank those many of you who've done this catch-up test for doing so to remain in compliance. And if you have received notification to do this catch-up test, or if you look at your Reopen CU app and the testing box under requirements is not checked, please do schedule an initial gateway test as soon as possible so you can retain campus access. We then have a few different aspects of surveillance testing. The most critical is our random sampling that occurs every week. And the size of the sample was increased from the original 5%. It is currently at 10%, and we derive that sample from those who've accessed campus the prior week. Full participation in this is really essential in order for us to be able to accurately evaluate the prevalence of COVID-19 on our campuses. So if you do get an invitation for the random sampling, we do ask that you fulfill that test. At the beginning of October, we added a pilot voluntary testing program. This was for graduate students, faculty, and staff who were accessing campus 2 or more days per week and wanted to avail themselves of weekly testing. This program has been successful, and so we are continuing it through the semester. Even if you did not participate yet, but you would like to start, so long as you meet the criteria of accessing campus 2 or more days a week, you are welcome to participate in this voluntary testing, which happens weekly. We've also added a travel-related testing program. This acknowledges the guidance from the state around departure testing before the holidays for our students, as well as the testing requirement to end quarantine after return from travel. I'll speak about that in a few minutes. And we are now able to accommodate this at our testing sites as well. For each of these different kinds of testing, when you go online to schedule your appointment, you can select the kind of test you need. The one thing we do not do on our testing sites is symptomatic testing. Please don't come if you're having symptoms, because this really puts other people at risk. This kind of testing should be done with a clinical evaluation. So for faculty and staff, we ask that you reach out to your primary care provider or an urgent care center. And for our students, direct them to their campus student health service for symptomatic testing. So how to participate in the testing program: go to the covid19.columbia.edu website, click on the testing page and review the options for eligibility for testing. Access to testing is available on both the Morningside and Columbia University Irving Medical Center campuses with these high throughput, very convenient, large-scale testing centers. For Morningside at Lerner Hall and for CUIMC at the Black Building. An appointment is required. It can be scheduled through the secure portal where you select your appointment type, your day and time. Appointments are in 10-minute increments. They are very quick and efficient. Most people report completing the entire process from entry to exit in less than 5 minutes. On the day of your appointment, please complete the attestation. Remember, if you have symptoms, cancel your appointment and reach out to your primary care provider. And when you come to the appointment, the staff will guide you through the testing site. The test is a very simple, observed, self-collected anterior nasal swab. It's quick, it's painless, and we are partnering with the Broad Institute for our testing. Your results are usually available in about 36 hours, and the results come from Care Evolve and will come to your Columbia email address. If you haven't received your results in 72 hours, please email covidtesttrace@columbia.edu and we'll help you to troubleshoot. If you do test positive, we will call you by phone to give you those positive results. So on contact tracing, as you know, it's an important strategy to prevent spread of COVID-19. For individuals who are diagnosed with COVID-19, we ask them to identify anyone with whom they had close contact while they may have been infectious based on the CDC definition of close contacts. And these contacts are then notified about their potential exposure without revealing the identity of the person diagnosed. And those contacts are asked to quarantine for 14 days. They're also given guidance and resources on how to take care of themselves and prevent transmission to other people. Back in August, Columbia University, through a partnership between Columbia Health and ICAP, established a comprehensive contact tracing program utilizing New York State guidelines so we could do contact tracing here. We've used the guidance from the CDC, the local public health agencies, and our tracing program uses protocols and best practices for contact investigation and notification. Our goal is to assist in conducting tracing for all COVID-19 cases identified among Columbia affiliates through our testing program or reported to the university through the symptom attestation process, to human resources, or to our email covidtesttrace@columbia.edu. We have contact tracing teams assigned for all campuses, and we've partnered with the New York City Test and Trace program to ensure coordination of contact tracing efforts and connections to city resources. And again, I have to emphasize that the contact tracing process is confidential. We don't reveal a case's identity unless they specifically request that we do so. There are many ways that individuals who test positive are connected with the tracing program. Obviously, if you test positive through our testing program, you're notified by us of your result, given the guidance, and then you're informed that the contact tracing team will call you for the interview, and we internally connect with the contact tracing team. If you attest to having a positive test via the app, or if a student tests positive through a health center, they're also connected to the contact tracing team. And if you're tested outside of Columbia, either you or your supervisor should email covidtesttrace@columbia.edu to notify us of your positive test. And we will then notify the contact tracing team, and a member of the team will call you for an interview. As I mentioned before, our goal is to call you within 24 hours of your positive result. We ask that if you do test positive, you can certainly let your supervisor know, but we ask that you not try and conduct your own contact tracing. This has led to people telling multiple others that they have been exposed without really understanding the infectious window or close contact criteria, and this can create a lot of confusion and add unnecessary anxiety. So please be assured that our team will be in touch and can do a full and thorough investigation. So the first step in contact tracing is notification of a positive case, often on the same day, but always within 24 hours, including weekends. The university contact tracing team will telephone the case and do a full and complete case interview. If you're unable to answer the call, they'll leave a message and send an email. And we do ask that you respond as soon as possible so we can do this critical first step evaluation. During this interview, we ask a lot of questions about your infectious period. We check how you're feeling. We give you resources. And then we ask you about your close contacts during the time you were infectious, which is 2 days before your symptom onset or 2 days prior to testing if you have no symptoms. We'll ask you about members of the Columbia community who meet this definition, as well as any household contacts if they are Columbia affiliates. And we'll also let you know that you'll hear from the city or state contact tracer to assess your contacts outside of Columbia. We'll assure you of your confidentiality. And once this is completed, we notify the impacted school or department to let them know a case has been identified, how many potential contacts there are, and what, if any, facilities disinfection is needed. As I say, your privacy and confidentiality are paramount, and we don't reveal any of this unless you agree to such a disclosure. The CDC recently updated their definition of a close contact, so we use both the New York City Department of Health definition of a close contact, which is someone who you've been within 6 feet of for more than 10 minutes in a single instance, as well as the CDC definition, which is someone you've been within 6 feet of for a cumulative time of 15 minutes or more during a 24-hour period. This change has actually increased the number of people who will fall into a close contact category if 6 feet distancing is not maintained. Outside of clinical settings, use of a mask or face covering doesn't impact the close contact definition. Then the second step in the contact tracing process is connected to all of those who meet the criteria of a close contact. The contact tracing team reaches out by phone and explains that the individual has been identified as a close contact needing to quarantine, give them resources and information, and we notify the school when this is complete or if we need assistance reaching people. During both isolation and quarantine, the contact tracing team reaches out to check in and see if there are any questions. I want to emphasize again that if a person has not been contacted by either a local health authority or the university test and trace program, they are not considered to have increased risk based on exposure to the individual who was diagnosed, and so they don't need to quarantine. While they may know the identity of an individual who tested positive and may know that they have seen them, they don't meet the threshold for either close contact or their contact was outside of the infectious period. I should say our contact tracing process has been highly successful. We've been able to connect with cases and contacts very rapidly, and by doing so, we've successfully quarantined individuals before they become symptomatic and thus have prevented spread to other people. We've traced hundreds of close contacts to date. The biggest lesson that we've learned so far is where close contact is happening, where that 6 foot is being breached. It's not happening in classrooms. It is happening during lunch and break times when people want the social contact. They take their masks off, they sit close together. It happens during social conversation. So I ask you, please take that into consideration during lunch and break times. Check where your desks are or where your lab stations are and make sure they are over 6 feet apart. Real quick, I just wanted to remind you, if you haven't already done so, to look at the New York State COVID Alert app. This volunteers in SEAS and the business school were instrumental in piloting this app. It provides up-to-date data about the status of the pandemic in New York, but can also alert you if you've been in close contact with an unknown person for more than 10 minutes, for example, in a grocery store or on public transit. And you can get guidance on quarantine for an exposure after that. We've already had Columbia affiliates successfully notified because of this technology. Just very briefly, I did want to share with you the updated New York State travel guidance. Previously, traveling required a 14-day quarantine if you were coming from out of state or a different country. But this has changed. And for travelers who are out of state for less than 24 hours, no quarantine is necessary, but you're still required to fill out the New York State travel form. And on day 4, get a diagnostic test. This travel testing can be scheduled at our testing sites. For travelers who are out of state, so for any of the non-contiguous New York states or abroad for more than 24 hours, you must obtain a test within 3 days prior to your departure from that other location before you come back to New York. When you come back to New York, you must quarantine for 3 days and complete the traveler health form on the New York State website. On day 4 of your quarantine, you can get another COVID-19 test. And when the test comes back negative, you are able to end your quarantine. And again, those travel-related tests can be scheduled at our sites. That's all I have. Thank you so much for everything you continue to do. And I will turn over to David Greenberg.
Thank you, Melanie. I will share my screen now. And okay, there we go. So today I'm going to just give a brief overview. I know we want to get on to the Q&A of updates on our cleaning protocols, some new services that we've put in place during the fall semester that will also lead into the spring, and touch on the planning that we're extending into the spring term. The cleaning protocols that we put in place for the fall do continue. We continue to address high-touch areas on a more frequent basis and using the CDC recommended products, and this will continue on into the spring. And we have established protocols, so if there is a confirmed case of COVID-19 on campus, the area is shut down for a period of time in which we do extensive cleaning and sanitizing of the space within 24 hours, and then reopen the space once it has been sanitized. For specific details around our cleaning protocols, they can, of course, be found on the COVID-19 website. The recent industry guidance and CDC guidance has pointed towards our heating, ventilation, air conditioning systems as something that needs extreme focus as it comes to containing spread of COVID. And our protocols, again, that we put in place in the spring have been to overhaul our air handling systems, modify them, repair them, to improve airflow, outside air, enhance filtration to standards that filter out virus particles in terms of the filtration that we use. And we've also put in place a ventilation monitoring for spaces of classrooms, public areas, such as lounges and research spaces. We've been working with faculty in Cs who have expertise in aerosols, and we are checking airflow rates and also in places where the airflow is not quite up to where we need it to be for the occupancy of that room. We have installed supplemental HEPA air filters for those rooms. That is also in line with CDC guidance for that. And we are continuing this monitoring across campus. These details are also on the COVID-19 website, which can be accessed here. We have building readiness information for all of our academic buildings that you can access on the website. You can see links to individual buildings. And on the right-hand side of the screen, there's detail about the air handling, quality, the cleaning, specific to each building that you can access. The services that we've added on campus in the fall semester, you've heard Ira refer to tents, which we have added on campus. And for those of you who have been on campus, you've seen we've added 4 large tents on campus at Hamilton, Ansel Plaza, Fairchild Plaza, and Dodge. And we're considering for the spring putting another one over by Fernald on the lawn there. These tents are, again, relatively large, 50 people capacity with social distancing and the furniture layout that we have in there. And details can be found on the event management site at eventmanagement.columbia.edu in terms of how to use space and reservations. In addition, in the past week, we have put in electric heaters so that these tents can be used throughout the winter. And they'll be operating from 9 a.m. to 10 p.m. on a daily basis. As you can see, these are pretty significant tents. Furniture is laid out with 6-foot separation in terms of diameter of the table. And they add a fair amount of programming space and also community space for people to do work, eat lunch, etc. Another service that we enhanced over the fall that will continue into the spring is on the transportation side. The Intercampus shuttle has Saturday service now. The routes do extend down to 96th Street to pick up some more passengers for Morningside and the Medical Center campuses. And the continued service on the Fort Lee and Lamont shuttles is in place as well. I know that there is concern about capacities on several of the shuttle buses, and we monitor that on a daily and weekly basis and work to improve service or add service as it approaches the maximum capacity allowed. In addition to the Intercampus shuttle enhancements that we put in place, we have put a commuter shuttle in place for students, faculty, staff, that you can see a map here on the right that reach out to various boroughs and also travels on the east side. This has been mapped out serving some of the higher density areas and connection points in accordance with the travel study that we did for the university population. These seats can be reserved in advance. I'll show you that in a second. And this operates continuously throughout the day. As with all our shuttle services, face coverings and reduced density are mandatory on all of our buses. There's a 4-step process for reserving seats. They can be reserved as far in advance as 2 weeks. You can go to transportation.columbia.edu to buy your tickets and use a website to pay. There is no app at this time, but it is available through a browser. And your EVPA cards can be used in terms of payment as well. Touching briefly upon planning for spring term in 21, we have learned a lot of lessons over the fall. We've provided housing for over 950 undergraduate students in our residence halls. We've prepared meals for students in quarantine and isolation, delivered meals to them, and we continue to provide a grab and go and take out service for 1,000 students currently. We are still looking at ramping up for the coming spring for the announcement that went out today in terms of bringing seniors and possibly others onto campus. And we will be having the same guidance as far as single bedrooms for all undergraduate students. We'll be maintaining very low bathroom or bathroom fixture to student ratios, at least 4-to-1 or better. And we have a Fernald hall will be reserved for isolation housing as well, and continue to follow all CDC guidance on the maintenance of these facilities. On our professional and graduate student housing side, our Columbia Residential will continue the policy modifications that we've had in place throughout the fall. Reduce occupancy in shared units. There are no shared bedrooms, so everybody has a single bedroom as in the undergraduate housing, and the same reduced ratio for bathrooms. We're improving flexibility for scheduled move-in and move-out to customize it to the students' needs to reduce peak time move-ins and dates when people will be moving in. And we've been working with the graduate schools on their allocations and giving priority to students who did not take housing in the fall, that they will be able to come back and get housing in the spring. And to supplement the isolation housing that I referenced on the undergraduate side, we've also set aside apartments across the apartment portfolio for graduate professional students as well. Just to echo what you've heard from Melanie and Wafaa, that we'll face many challenges as the fall comes up. We have some places narrow stairways and hallways, and elevator wait times will increase possibly. So please remember to follow all of our guidance, take the stairs if possible, keep 6-foot separation, and wear a mask, please. And with that, I'll turn it back over to Jerry.
Thanks, David. I had 3 topics that I was proposing to cover, but in the interest of trying to get us as quickly as possible to the Q&A, let me just comment on one of them and do that very briefly. We spend a lot of time in this kind of conversation focusing on people who are on campus, and we're understandably very proud of how many people have come back and how safe we managed to keep them. But I wanted to say a word to those of you who are working remotely. In the first place, thank you. By proving that you can work effectively off-site, you're letting us keep our performance at a very high level while still making it possible for us to achieve our density goals, and that's really critical. But those of you in this category are understandably wondering, when are you supposed to come back? And what kind of notice are you going to get when it's time for you to do that? So let me speak to the notice issue first, because that's the easiest. Our policy has been, and we continue to adhere to it, that we are going to give you 3 weeks of notice before asking you to stop working remotely and start working on site. There may be some limited exceptions where urgency makes that impossible, but as a general matter, we're going to give you 3 weeks to try and adapt to the challenge of moving your work environment from home to campus. That still leaves, though, the question of when should you expect that notice? Last summer, the advice that we provided was that those of you in this category, those who are working effectively off-site, that you should assume you won't be back through the fall term. So the question arises with the end of the fall term in sight, does this mean that you should assume you're coming back in January? And the answer to that is certainly no. Now, again, what this means for any particular employee depends on what you, your supervisor, your unit are asking you to do. But for administrative employees generally, although we don't yet have a date that represents a target for your return, it will be well into the fall term. So you shouldn't be looking forward to a January 2nd return to campus. Let me pause there, go to Joseph and see what we can deal with in Q&A.
Hi, everyone. Thank you for the opportunity to be here. I'm going to share my screen like everyone else. Well, it's telling me it's failed to share. Let me try one more time. There we go. So I'm going to talk a little bit about the student experience and all the work that's been happening in that space with the schools and all the central units. And I give gratitude to everyone and all of you for all the work you've done. A couple of things: we continue to keep students informed. We sent out a Friday message to all students about keeping the compact and provide resources. We launched the student campaign as far as student voices, because peer-to-peer support is critical as we are working with students and keeping the compact. And we have over 595 students so far have received specialized training. And if you have a group of students that you would like to be trained, please reach out to universitylife@columbia.edu, and we'll get you connected to our partners at Columbia Health who are leading that effort. I was going to share, but for the purposes of the time, I want a 30-second video of Ochuko. But Ochuko is one of the many students who are sharing her voices about the student experience and the compact and why it's so important. And you can go to the University Life Voices website, Student Voices website, and hear all of the students and their incredible stories in this space. I also wanted to share that the Keeping Our Community Healthy Student Ambassadors are vibrant and doing incredible work. We have over 424 trained ambassadors. They've been trained to step in and to educate their peers, both in person as well as virtually. They're contributors to our Student Voices campaign. This is a quote from one of the students who walked around campus and was engaging with students and had a positive experience. I'm happy to also say that they are now fully student-led. We have 3 incredible students, Pilar, Kyla, and Shelly, who are leading the effort. And we are also in connection with COVID-19 Student Services Corps, which was founded by CUIMC students, but open to all students and doing incredible work holistically around COVID-19 and its impact. We are training more students in the spring, and we'll recruit more students in the spring with the train the trainer model as we move forward. As far as student accountability, a few reminders. Everyone can ask another community member to please put on your mask and to physically distance. And we ask that you do that. If you need assistance in doing that, you can ask a fellow faculty member or a staff, or you can also reach out to public safety and they will join you. If they do not comply, you can submit an incident report, and you can do that on the University Life website. There's a visual here, it's on the top right-hand corner. And you can please provide detailed information in the report. If you have the student's name, that's ideal. But if not, as much detail as possible is important for our follow-up. We're doing daily briefings as we track student reports. These are all students and student specific. So we've had a cumulative number of 618 reports. Most of them are just not wearing the face covering and physically distancing. That came from 179 reports. And we're able to follow and track trends. You'll see big jumps here. Those big jumps are really singular incidents where students were congregated together. The 76 was people were in line with masks but not physically distanced. The 82 is a report that just came in that we're looking into around the travel policy. We're also doing a resolutions report monthly. A couple of things I'd like to highlight here. The largest number of students in this space are students that we didn't have enough information that we could really move forward with. And so I just want to reiterate, please fill out a report. Please provide as much detailed information as possible. We do everything we can to locate that student and to connect with them with education as a starting point. Please also wanted also to focus on the fact that the second largest group is all around education. And I'm happy to say too that, you know, we've been successful. I think we are changing culture around students who are not in compliance. We have done that without any suspensions. We have restricted access when needed for a few students on a couple of situations, but you know, it's working and what we're doing, and students have been really great about following the compact. We're continuing to host virtual events for our students. We had over 18 virtual events with over 7,000 participants. And I also want to highlight, you know, student well-being continues to be at the forefront of everything we do, including our partners at Columbia Health and CYMC Student Health Services, providing virtual counseling, referrals, support groups, 24/7 phone access, emergency phone access, and they're available to you. If you see a student, if you're worried about a student virtually or in person, please reach out to them and consult with them and partner with them to get that student the support that they need and the support that you need. Last but not least, I'd like to share that the Global Centers have been working throughout the campus and with the President's Office and key partners throughout the campus on an initiative to support our international students at this time. So we have our Global Centers open. We have 7 of them open and supporting students globally. We have also opened additional spaces through the partnership with WeWorks. And we have over 50 cities on top of that students can access support spaces in that. And this has been an incredible effort to provide physical spaces that meet the compact and the compliance of our campus, but also to create virtual programming and specialized programming and communications to support our international students to keep them connected to all of us here at Columbia. And so those are a few highlights I'd like to share. Thank you.
Great. Well, thank you, Joseph, and thanks to all the speakers. We have gotten over 120 questions while everybody's been speaking, and a number of us have been trying to type quickly to respond to those, but there are some that I'm going to turn directly to the speakers for. And one I'm going to turn to Ira is a question about undergraduates being allowed back on campus during the spring. I think the intent of the question is not, since they were allowed back on, it's a question of having classes being more in person or hybrid. So Ira, that is a question for you.
Good. Thank you very much. And thanks to everyone for this terrific webinar. As I said earlier, the plan is to invite seniors back into residence, give them that opportunity, and decide, density permitting, whether to extend an invitation to any other undergraduates into the dorms. With respect to teaching modalities, there was a restriction in the fall term on any but virtual teaching for 1,000, 2,000, and 3,000 level courses, that is basic undergraduate courses. They were all taught only virtually. That restriction will not exist for the spring. It continues to be a decision of individual faculty regarding the modality in which they will teach. I know that many programs and departments have been considering together how and when to take advantage of hybrid options for undergraduate instruction as the spring comes round. I think it's worth noting that where hybrid education has taken place across the campus for graduate students in professional schools, in clinical education, it has proceeded entirely safely with proper distancing in the classroom, with masking and the like. And many of us very much hope there will be a mix of teaching available in the spring, but the ultimate decision continues to reside with the individual faculty member about how she or he wishes to proceed with instruction in the spring.
Great, thank you. Melanie, this one is for you. This is an individual who is traveling out of state, but will be back, obviously a non-contiguous state, but will be back within 24 hours. The daily attestation doesn't speak to that. What should the person do?
So this is where those drop downs on the daily attestation actually do work. because one of the options is I have met the testing and quarantine requirements. If you're traveling for less than 24 hours, you do not need to quarantine, and you fill in the form and you test on day 4. So you can actually check that I have met the requirements and not get the red pass, but do be sure to get the test on day 4. You don't have to quarantine while awaiting that test if you're less than 24 hours.
Great, thank you. Wafaa, there's a lot of questions about the vaccine. I have no doubt that you have seen them, but a couple of the questions relate to who Columbia will be providing the vaccine for. Could you address that?
Yes, and I've been working on answering a lot of vaccine questions during the webinar. We have a group that's been pulled together, and Jerry Rosberg is leading that group of several individuals who'll be meeting to actually develop such a plan. So stay tuned. We will get back to all of you with the Columbia plan for vaccination.
And a couple of other questions about the vaccine is, what does 90% or 94% mean in terms of the 2 vaccines that have been announced?
Yes, what it means 90% protection is that if you have, for example, you have 30,000 individuals who have been enrolled in one vaccine study, and there were 100 cases of COVID identified in that study, that essentially 95 of those 100 cases have occurred in those in the placebo arm, and only 5 cases have occurred in the vaccine arm. So you look at the numbers of cases in the placebo arm, the number of people who got COVID in the vaccine arm, and based on the difference between those 2 groups, you determine that the effectiveness, the percent effectiveness. So 90% is superb, very high efficacy.
Great, thank you. There's 2 questions, and I'll lump them together, and I'll be the person to answer them because they relate to Haven Plaza, and questions about whether or not we could get a tent at Haven Plaza. We actually do have 2 small tents right outside of the Alan Rosenfeld building, but we are looking into if there is a possibility of having a tent that actually has closed flaps and also has the potential for more space. So that'll be something we'll follow up on. We have a question, and I guess I'll turn to Melanie on this, and David, either one of you. If an employee has to quarantine, are there options for quarantine housing on campus for employees?
So I'll turn to David. My assumption is no, but when we do contact tracing, either for a case for isolation or quarantine, if people have expressed difficulties about that, our contact tracing team does connect them with the New York City hotel program, where there are options for isolation and quarantine.
Great. We have a question about the commuter shuttle, and this is for David. Why does the commuter shuttle not observe the 6-foot distancing requirement?
The commuter shuttle, we have reduced density factors on there, and the spacing should be sufficient for the capacity that we have listed. I think that these are motor coaches where we have a capacity limitation of 25. If that spacing is not appropriate, we'll take a look into that.
Great. And I've ridden the commuter shuttle a number of times, albeit really early in the morning and late at night, and I've definitely observed there are straps across the seats. But again, if you're observing something else, you should let David know. We have a question about using the travel testing, meaning the testing right before Thanksgiving, even if someone is working remotely. Melanie?
We generally encourage people who are not accessing campus for any other reason not to use our surveillance testing sites and to use a local site by them for that kind of testing.
And please also, there are lots of testing sites in the city, and please go to the New York City DOH website to see the testing site near you.
Great. David, is ventilation in classrooms being tested, and what are we doing about poor ventilation?
So yeah, we are doing airflow testing in classrooms and some of our public spaces, such as lounges and research spaces. And for any areas that need assistance, we're going in, or improved ventilation, we're going in, we're fixing them, and until they pass the test. And there are a few, very, very few, where we put HEPA filters in, which is in accordance with CDC guidelines for those spaces.
Great, thank you. We have a question on events, which I'll take. Will guidance still preclude in-person events during the spring semester, even though some undergraduate students will be back on campus? First of all, the governor does set the limits on gatherings, what we call gatherings or events at 50 or under. And obviously classrooms, will have to meet that standard. But for social events, we are actually looking at the gathering size. We certainly don't want to be in the position of sponsoring a social event that has some spreading capabilities. It's hard to monitor some of these, but I think prudence says, small events, 10 or fewer, is really the best thing for us to sanction and to hold. David, a question on cleaning in Columbia buildings, not just Morningside and Manhattanville and CYMC, but also Lamont and Nevis.
Yeah, so at the Lamont and Nevis campuses, they too have undergone enhanced cleaning and outfitted their spaces for social distancing as well, yes.
And another one for you, the furniture near the tents is often moved, and are there any plans to try to monitor that a little bit better, or put instructions outside of the tent so that people don't move the furniture?
So we do monitor it and we reposition it. If it's not being done frequently enough, we'll increase that. And there is signage outside and within the tents, but we will always be happy to put in more signage as necessary.
Great, thank you. Wafaa, there's a couple questions about our monitoring plan. As Wafaa mentioned, we do have a plan that establishes certain criteria. Could you, besides the positivity rate on campus, could you identify a couple of those cutoffs and when Columbia might move to a new level?
Yeah, I think we have a draft of a monitoring plan that takes into account a lot of different metrics. Some of them are city metrics, like numbers of cases, positivity rates, as well as hospitalization and the RT, the transmission rate in the city, and also campus-related metrics as well, in terms of whether there are any clusters on campus, our own capacity to isolate and quarantine students, and so on and so forth. It's a very complex matrix, but what we have is essentially developed thresholds or target thresholds for a variety of the different metrics that then would motivate specific action. So some would include, for example, if the transmission rate on campus is higher than transmission rate in the city is one example that I can think of, higher by 50% if our transmission rate is higher than the city's transmission rate. So we have a variety of such metrics that we are keeping an eye on every day. And then we have also listed a variety of different levers and actions that we put in place to address any of these, if we reach any of these thresholds.
Right. Maybe related, Wafaa, there's a question about research laboratory capacity on Columbia's campus. Back when we started the research ramp up, we had a much lower positivity rate, but it's ramping up. And what do you see as the balance in terms of letting more people back into the labs or potentially reducing them?
I think we also have as well taken our own monitoring plan and had our research group also take a look at it and adapt it to the research environment. As you know, the threshold now is no more than 50% density. But nonetheless, of course, this varies from lab to lab. And the most important thing is to make sure that whatever density is there, that there has to be appropriate distancing between individuals in a specific lab. That's very critical. And to also be very careful about distancing, particularly during breaks and lunch breaks and so on, where people are more likely to get closer together and also remove their masks to eat and drink. Very, very important. Most important is the distancing.
And Jerry Rosberg led the research ramp up. And Jerry, we have a question about how much advance notice would there be if we did have to move to a shutdown of research activities?
So I don't believe we have a fixed date for that, a target. We spent within the research ramp-up group led by Rui Costa a lot of time talking about preparations for a possible shutdown or a scaling back so that we're ready to do that. Donna, can I also say, because I can see from the Q&A, that I misspoke evidently in what I said about the return date. What I meant to say was not expecting to return at the end of this fall term, that we haven't set a general return date, but you should assume it will be well into this coming spring term. So apologies for giving a misimpression.
And I think I've answered a few of those questions over the computer, but thank you. I want to turn to Ira because there's a couple of questions around faculty having discretion over the mode of instruction next semester, especially for undergraduate 1,000, 2,000, and 3,000 level classes. And the question is, will faculty in fact have the option to teach those courses in person or in HyFlex, or will they still be online only?
No, faculty will have the option in the spring to teach HyFlex, various modes of hybrid that involve face-to-face, as well as virtual instruction. So what was essentially a ban on anything but virtual in the fall has been lifted.
Great, thank you. We've had a couple questions. Melanie, I'll turn it to you. And I know this is a difficult one to answer, but the questions relate to how we will monitor travel that does occur on Thanksgiving and the return to campus.
So the monitoring is actually done by New York State. You are required to fill in the travel form. There are penalties for not complying with the state, and a lot of monitoring will be happening through them. So that's where the bulk of the monitoring will be happening. We do, want everyone to be honest around this, and that's why we're making it easy to support the travel-related testing so that you can comply and do the appropriate quarantine and then testing. Ultimately, this boils down to wanting to protect the community, and we hope everyone really buys into that, because that's the reason for doing the quarantine and the testing after you've been in a higher risk area or doing a higher risk activity.
Great. We have a question about the questions, which is, are these questions going to be posted? First of all, the entire session, as I mentioned, is being taped, and it'll be available on the website, and we'll work off, if we haven't gotten to your questions, we'll work those off as well. David, there's a couple questions about the safety of the tents, particularly, I guess, sort of two aspects. One is the safety of them from a ventilation perspective, and are they not, in fact, the same as indoor dining once somebody actually pulls the flaps down?
So our tents are operated under the New York City guidelines that require 50% of the sides to be open. So we are maintaining them in that way, and they will be heated, but they will have the proper airflow. If there are some indoor dining facilities that people see that have more than that, those are not in compliance with New York City regulations. Great,
thank you. I'm going to turn back to Ira, the Provost, for a question about the 21-22 academic calendar, and wondering whether or not we'll be following the 2021 three-term structure.
I think it's just a bit too early to answer that question. Our hope is that the campus, indeed the city, the state, the country, the world, will have returned to as near normal as possible by the fall. And if so, we would return to our traditional calendar. I should add, we've learned something from the present calendar, which a degree of flexibility, for example, the divisions between fall A and fall B, spring A and spring B, which have introduced flexibility into our calendar. We've actually learning about aspects that some schools have already adopted in the past, which we might wish to keep for the future, even as we would return, as we would, I hope, to a more traditional calendar.
Thank you. And maybe bringing it a little closer to home, commencement day or in class days for May, have there been any decisions, and when would we, if there haven't, when might we anticipate that happening?
The current calendar, which has been adopted, calls for a commencement to occur at the end of April, given the earlier start of the spring term. But there are moments in May and in June when degrees can be conferred. So students finishing their careers at Columbia can participate in the commencement at the end of April. But if they need to delay a bit to get their formal degrees, for the formal conferral of degrees, that will happen, could happen both in May and in June.
Great. We have a question I think I can answer, which is someone asking if undergraduates living off campus could potentially take classes on campus, even if they're not seniors. That is correct. So it depends on the mode of instruction for your individual classes. You don't have to be living on campus to be able to take them in a high flex or in-person version. Let me just, Jerry, there's a couple questions about, are we at all rethinking the mode of work remotely on a permanent basis past this crisis?
So I think the conversation is definitely underway. And I think in the same way that we're learning a variety of lessons from this experience about what will happen going forward, that we certainly will be informed by what's actually worked well and where things can be done better here. But no decisions made yet. That's all still to come. It seems premature until we're out of the woods on the problem we're dealing with now.
Great. One last question, because we're just about out of time. Cold weather approaching, I suspect there will be people developing non-COVID related coughs and sniffles that could persist. How should people approach symptom attestation in these cases? Melanie, and that's an easy one because we actually adapted the app to deal with that, but please answer the question.
Exactly. We don't want you to have to lie or try and differentiate. So in these situations, if you again click on the app, you'll see the drop-down options. And we ask that you get clearance from your healthcare provider that this is a non-COVID related issue. And in that case, you can answer honestly, you can check the box that you've been cleared by your healthcare provider and you will get a green pass.
Great. Well, I want to thank all the speakers, and Joseph, we didn't throw any questions at you, but I do want everybody to remember one of the things that Joseph mentioned is that if you are reporting on a violation, it's important if you can be more specific about the violation, including the name of the student or the faculty or staff member, because otherwise we won't be able to follow up. And we take compliance very seriously. So again, thank you. There were well over 1,000 of you, and I don't know the final tally on the questions, but I hope we got to most of them, and if not, we will be following up. So thanks, everybody.
Thank you.
Thank you.
Take care. Bye-bye.
Cheers.